We are your typical American family. We're your neighbors. The last thing from our mind was that we would need help paying for medical bills for our child.
UHCCF allowed Juliet to just relax.
When I found out about it, it was like running home to tell Brian, like, we have an answer.
Yeah.
This is how we're gonna make it work. Juliet is pretty much a normal, healthy kid. In 2015, when she was 7, we were on a vacation for spring break, and we started noticing some troubling signs, some very odd behavior happening.
When I was 7 years old, my parents noticed that my speech was getting slurred and that I couldn't do things that a normal 7-year-old could do.
She was a very gifted, smart girl, and she was very articulate, and all of a sudden she couldn't speak.
They took me to the emergency room when I couldn't put on my own shoe.
They did all sorts of tests. They did CT scans, and then the doctor came in, a cardiologist, and listened to her heart and determined that what he thought was rheumatic fever.
10% of people who have rheumatic fever have this neurological condition, and it's basically the same thing. The immune response is attacking your heart, but it's also attacking your neurological centers.
I had to stay home from school. I was on bed rest, and I couldn't even read, write, do crafts like you would expect a 7-year-old to be able to do. I basically just had to sit there and watch TV all day, which sounds like a dream, but it gets really, really repetitive.
The first year, of course, we maxed everything out of pocket. And then the second year is when we started to really see how much every visit was gonna cost us. Every one of those visits, $650 to $700 for our portion of it. The social worker at the cardiology clinic is the one that suggested United Healthcare Children's Foundation to us.
UHCCF really allowed us to focus on what we should be focusing on at the time, which is our daughter and her health and her care during, what was probably the hardest time of our lives.
It just felt good to know that we had a way to stay with the team that knew our situation, knew our family, and was gonna take care of her.
We don't see any barriers to her future. She's been thriving. She plays lacrosse, she does cross country.
Now that I'm better, I resumed all my sports. I do lacrosse and cross country for my middle school, and I'm really an active kid with a very busy social life. I'm back to myself. In the future, I see myself at Brown University studying to be a pediatric cardiologist and saving others' lives like my cardiologist saved mine.
She's going to be successful in anything she does. She's self-driven, she wants to make a difference. She's seen people that can make a difference, and she wants to, follow them.
To know every time we walk into the hospital, we're getting the best care because we don't have to worry about affording the best care. That worry is taken away from us.
I want to say thank you to everyone who donates for not just changing my life, but for changing others.